Do diabetics need to supplement or they don't? And if they do, what are the supplements that at drd.com we should recommend them? Hi, good morning, good afternoon, good night, wherever you are. I am Dr. Gombele. I'm inviting you again in another series of our health presentations. Should we supplement? The answer is yes. It's virtually impossible though to live without supplement. As a continuation of this presentation, I'm going to present to you the most 10 important supplement for a diabetes patient. But before we go though, I'm going to ask you as usual, Monamboka, il faut s'abonner. Chakombo na wena suka. Amigo, comment estás? Suscríbete. Hein? Mon ami, comment il faut s'abonner? Subscribe, like, share, and click the notification bell so that when I upload my very next videos, we can notify you. Definitely, the answer here is that yes, supplement is for everybody. It's virtually impossible to live in this age of technology, of different techniques of agriculture. Some are good, but some are not good, but we cannot avoid them, right? And they deplete the minerals that we have in the soil. What are then the best supplement for diabetics? We have arrived to the conclusion that we have to supplement. It's virtually impossible to avoid the supplement. And then now, here we're going to introduce the 10 best super supplement for diabetics. Number 1 is magnesium. Magnesium is the supplement, and sometimes it comes in pills. All right, they are a little bit big, but you can swallow. All right, or they also can come in powder. This magnesium powder that you take a small spoon. There is one right here. All right, you take a very small spoon, you put in the liquid, water, juice, milk, and then you drink, right? The first one is magnesium, and there's a reason why magnesium is the first, because the expert estimate that up to 50% of the American population suffer from magnesium deficiency, right? And magnesium deficiency can manifest itself in various ways. One of the ways is that you can develop cramps, muscle spasm, and then sometimes in the severe cases, you can have some uncontrolled movement. And talking about magnesium, it brings in my mind the 16 years of a very prominent high school in Kingston, whose mother brought her at the hospital. It was at the end of the shift. The porter brought her saying that she was having seizure. But when I went near to her, the eyes were open. When I examined her, she was having a seizure because she was coherent. She could look around and, But then I went through the docket and the neurologist of the hospital doubted whether or not she was really suffering from seizure. Well, I told her to get to me as soon as they are discharged from the hospital. She was discharged. They didn't give her any medication because they didn't really know what she was having. I put her on vitamin D3 and magnesium for 1 year. When she started taking, after 6 months, she went back to school because she couldn't go to school. The seizure-like activities were like every now and then. It was very disruptive at school. She went back to school, she graduated, she finished, she's working. So she became seizure-like activity free for 1 year only by taking magnesium and vitamin D. But remember, I didn't take her off any medication. She didn't have anyone. I put her on magnesium and vitamin D under my supervision. And then now, she may have one like in 3 months, 6 months, and she knows why. She may have eaten something, or she stopped taking magnesium for a longer period of time. So really, magnesium can help in some instance, right? So it is vital also for diabetes. Why? Because we have linked magnesium to low magnesium level is noted to newly diagnosed diabetic, right? They have low magnesium level. And then that's why we don't know whether it's low level of magnesium causing diabetes or diabetes is causing low level of magnesium. The recommended dose is 250 to 500 milligrams, right? And I like to advise people to take magnesium in the night because it kind of calm you, make you like you want to sleep. It relaxes you. And I also give my patient with migraine headache. So magnesium, you take it at night. The second recommendation, vitamin D3. It's also known as sunshine vitamin because exposure in the sun after 30-45 minutes, your body can start producing vitamin D by itself. So vitamin D is linked with decreased insulin release, right? Insulin resistance, right? On diabetes. So those who have low level of vitamin D3, they are connected to insulin, they are related to have insulin resistant, which really just type 2 diabetes mellitus, and they have problem releasing the insulin, right? So magnesium is very good for all diabetics. The recommended dose though is 5,000 international unit rated IU. 5,000. I usually take 10,000 every now and then. Now, the time is also important here because when you take magnesium in the night, vitamin D3 in the night, you may not sleep. It kind of gives you energy. So I suggest that people take the vitamin D3 when in the morning, preferably with a meal. The number 3 supplement that we are recommending is chromium, right? It is an essential trace mineral that the body cannot produce, and we don't need it too much, we just need a little bit. But it's very important in the formation of a compound in the body called glucose tolerance factor. And that compound helps the body to be tolerant to accept, right, insulin, so that insulin can do its job. Studies have confirmed that low chromium level is very high among the diabetes patient. So the recommended dose here is 2,000 micrograms, not milligram this time, mcg, microgram, any time of the day. You can take it in the morning or in the evening. They don't really have much of side effects as other medication. The recommendation number 4 is zinc, right? Zinc, it's also one of the very important mineral. The expert says that 12 up to 40% of the population, 12% of adult population, and 40% of the senior population in the United States, they are at the risk of developing zinc deficiency. Zinc is very important in the production, storage, and secretion of insulin. It participates in the production of insulin. It participates in the conservation of insulin and also in the secretion of insulin within the pancreas. within the pancreas. So it is very important. Zinc, you can take it at any time of the day. You can take up to 50 milligrams once daily. And I will pause here to say that during the pandemic, I used to see a lot of COVID patients. For some reasons, other doctor didn't see them. Maybe they just coughed. They said, oh, you may have COVID. I don't see you. So I was very busy having all these patients walking from one office to another because the doctor didn't want to see them. And they didn't want to come to the hospital because they saw hospital, long line and busy. So I didn't mind seeing them, line them up. And one of the minerals that I sent them home with was zinc. In addition to magnesium, vitamin D3, ginger, garlic, a little bit of aspirin if just coughing, and then rest, and then some medication for the cough, zinc. And then the results were very good because zinc also boosts the immune system, right? So the supplement number 4 here is vanadium. Vanadium, commercially known as vanadil sulfate. It's very used for diabetes, but however, it's long term, is used for long terms. It is not really well known. So this medication must be taken under an expert supervision. And then now, number 5, we have vitamin E, right? You don't hear much about this, but there exists a vitamin called vitamin E, right? It decreases the risk for cataract and heart disease. And these two diseases are prevalent within the diabetic community, right? It could be taken up to 1 gram every day. But studies have shown that 67 milligrams of vitamin E, it protects the patient from heart disease. It is also an antioxidant. That means it prevents patient from some small damages inside the body that can lead to the development of a cancer. People also use vitamin E as a blood thinner, right? Also, vitamin E boosts the immune system. So I like to call it like a natural blood thinner, right? So we have vitamin E, number 5, and vitamin B6, or the supplement number 6. It improves the symptom caused by the damaged nerves. And diabetes as a disease, it targets the vessels. And then nerve is among those vessels that diabetes damages, right? It helps to deal with the symptoms of damaged nerve. And those symptoms are like tingling and burning sensation, that type of pain, that traveling pain, right? And vitamin B6 helps to comfort those symptoms. But you must take it at least for 2 to 3 months, right? Just today you take one, oh no, doc, they call back, I'm not improving, I'm not feeling well. No, the experts say you should take it at least for 3 months before you really feel much better, right? And then now, the supplement number 7, we have selenium. Selenium now, it can be used also as a supplement, right? It also helps to control diabetes. Studies have been shown that those who take selenium after a long period of time, good amount of them come up with good blood glucose control. And then it can also be taken 50 up to 200 micrograms, not milligram here, microgram, mcg, microgram, right? So it is good. We have it in our list of the recommendation. Recommendation number 8, we have coenzyme Q10. Coenzyme coenzyme Q10. It is another supplement that I personally take. Right? It is very good for the heart. It gives a lot of energy, right? But for those who take statin as medication that we prescribe to control cholesterol. But those medications block in the body the production of coenzyme Q10. Then if you're really taking Lipitor, simvastatin, any blood lowering cholesterol, you must take coenzyme Q10. It helps to protect the heart, right? And then it also helps somehow in the control of diabetes, right? The recommended strength is 100 to 200 milligrams. I take it in the morning because it kind of gives me a lot of energy. So you don't want to take something that gives you energy in the night, because in the night you need to rest. You don't need much energy, right? So you just need this in the morning, and I usually take 100, and sometimes I take up to 200. They are not so big. They are small. You know, you can just put in your mouth and swallow. The supplements, the last one, the number 10, is called Syntra. Syntra. SYNTRA 5. This is a very, very strong supplement. If you are taking this, then you need to inform your doctor, because it brings down the blood sugar rapidly, according to the expert, because it have different components, you know, and that's why you need to inform your doctor if you are taking Syntra, SYNTRA 5. But when you take a tablet and it brings down your blood sugar, and you go to tell your doctor, be careful because it's bringing down the sugar. I mean, you don't have to be careful. That means whatever you are doing, apart from the prescribed drugs, that bringing down the sugar, you should stop it. If it is exercise, you can stop it. If it is you are taking Syntra and bringing down the sugar, you cannot stop it, right? Remember, these are supplements. The side effects are very negligible to compare with the prescribed drug that we do. So you tell a doctor, I'm not stopping this, you better change my medications. And there's no doctor who's going to continue having you on the same strength of medication when your sugar is going down. Definitely, they will have to do something about it. They will have to find out why it's going down. And if you say, I'm taking this, I'm doing exercise, I'm changing my diet, there's no other reason than cut down on the medication. In fact, I have a lady in my office, she was recommended to me, with multiple medications and metformin and Dionyl and this and that, 13. I said, but this is just too much. After I saw her, I put her just on 4 medication, Janumet, which is Januvia, and metformin, twice daily, aspirin, and something for high blood pressure. And then I put her on magnesium, vitamin D3 for 2 years. The 3rd year, she called me, she was feeling dizzy. When I asked what was happening, the sugar was going low. In the next appointment, I decreased the strength of Januvia or Janumet. And then again, after 3 months, we started getting those low reading. I took her off Janumet, and up to now, she's only taking hypertensive medication, and she's on vitamin D3, zinc, and the lifestyle and diet and exercise, right? So there's no doctor who will continue having you on the same diabetes medications, even though the sugar level it's going down. And if they ask you what you are doing, and you say, for instance, I'm taking magnesium, or I'm taking vitamin D3, do not stop. Ask the doctor to decrease insulin, or decrease metformin, or decrease diabetes, or decrease whatever else, because these, as we say, they are only what? Supplement, right? So these are the 10 super best supplement that we decided to recommend to you, so that you can put them in your list of medications, but you will not be taking 10 at one time. I strongly recommend 3: vitamin D3, magnesium, and zinc. You take those for 3 months, you get a break, and you can add maybe another one, maybe coenzyme Q10. You can add chromium, right? Or you can add vitamin B6, right? But to start with, I suggest you get the 3: magnesium, zinc, and vitamin D3, which the doses, the recommended dose, I explained them earlier. Because if you're going to buy 10, it's going to cost you more. And to have 10 medication, 10 supplement taking, plus your additional medications, it's just going to be too much. So we are concluding this, that the supplement mentioned above are not drugs, right? But they can drop the blood glucose, so you need to inform your physician in whatever you are doing, right? 2, vitamin D3, magnesium, and zinc are recommended to every diabetic in our group, right? Buy them and take them, right? It is not advisable to stop your other medication. These are my recommendations. Take your other medication, but remember to do exercise, eat well, magnesium, vitamin D3, and zinc, and keep your date with your doctor, so that in the checks, the doctor can see the change of the blood pressure drop, your weight drop, and subsequently of your blood sugar checks in the doctor office. And if the doctor asks you, what are you doing? You just say what you're doing. I'm exercising, I'm reducing my portion, I'm taking this. And then doctor will have no other choice than to reduce your medication. Though every dietary supplement, they can still have some reactions. Always tell your physician, right? While taking them, I'm closing, you must keep all the rules of a good diabetic: exercise, diet, education, losing weight, portions, right? Stress management, take your vitamins, right? Don't miss your date with your doctors. And if you miss, quickly make new dates, so that your doctor can monitor you closely, and then the doctor can see changes happening. You are losing weight, right? The sugar coming down, so that the doctor can take you off other diabetes medication. So, thank you very much. Mwana mboka, mbote, sanvoboni, my friend. Au revoir, amigo. Hasta luego, munganga, dokotolo gombele. Chakombo na suka. Osabone, pona ba numéro na biso et augmenté. Bye bye. Hasta pronto. See you soon.